Hi folks, I'm Dr. Derrick Eddy with Akron Children's Hospital Sports Medicine, team physician for the University of Akron Zips. I'm here along with Bubba, here to talk today about concussion. Unfortunately, a very common problem that we see in a collision sport such as football. So back in the old days with football, the reason why we went to a helmet like this, a hard helmet, is because athletes were getting a bunch of facial and skull fractures. And so the modern helmet has done a great job of reducing those. And so we don't see those hardly anymore. And we still do see the concussion. And so that is the trick of trying to develop a helmet that reduces the force transmitted from the helmet into the brain. Again, the reason why a concussion occurs is the force is transmitted to the brain and causes the brain to shake inside the skull, either front to back or side to side. And so we're trying to reduce that risk by giving extra special pads and cutouts and so to reduce that force. I tell my patients and their parents, it's very similar to a raw egg, where the yolk is the brain and the egg white is the cerebral spinal fluid that the brain floats in, and the shell would be the skull. And then we could take a bunch of bubble wrap and you could prevent that crack, the shell from cracking, but we can still scramble that inside of the yolk by shaking it and jostling around. So that is what we're trying to do, prevent with the new equipment. And so some of the things, again, what you would want to look for, headache, again, 91% of the time you see that. Dizziness, fogginess, dazed, confused, just not acting right, light, sound sensitivity, memory issues. Sometimes they'll repeat themselves and keep repeating themselves. Changes in sleep, sleeping too much, not sleeping at all. So those are the things that you want to watch out for. The treatment for most concussions, again, we do what we call mental rest. So we use this term, return to learn. So in school, we might have to modify how much schoolwork is done. Sometimes we might have to take them out school altogether, not for usually very long. And then as the symptoms improve, then we can get them back to school. As far as the physical part, we definitely don't want any contact, but we actually do encourage a little bit light activity even early on, which has been shown to actually get the symptoms down better a lot faster. The biggest mistake that I see my athletes make is not telling anyone when they have a concussion, when they have symptoms. Because those are the folks that get in trouble. Those are the folks that last a lot longer. We know how to treat this a lot better than we used to, so we can get people better a lot faster. But if you don't tell anyone, and if you keep playing and you keep getting hit, then it's going to be that much worse, and it's going to be that much last that longer.